2,400 cases, nearly 1,000 dead, and WHO says the real number could be 4 times higher. If you're just joining, this DRC Bundibugyo outbreak was hard to contain even before the counts spiked. Response teams have had to work around armed clashes, displacement, and restricted access. WHO already pulled health workers out of a treatment center after fighting broke out, and Africa CDC and partners have been trying to speed up delivery and surveillance all along.
This is Ebola Watch. Today, the math is outrunning the reassurance. Trials, funding, screening, and one country nobody was talking about a week ago. Sarah and Daniel, right after this.
DRC Bundibugyo Ebola outbreak isn't over. Follow us wherever you're listening, and the next chapter comes to you.
Particle rights.
The DRC Health Ministry Bulletin, using data to July 19th, reports 2,423 confirmed cases, 967 deaths, and a case fatality rate of about 39.9%, with 734 patients in isolation and 469 recoveries.
The Health Ministry count is now 2,423 confirmed, 967 dead. That's the number we've been following. But here's what changes the frame. WHO says actual infections could be 4 times higher. Do the math, and you're looking at nearly 10,000.
And the source matters here. That multiplier comes from WHO itself, right there in the situation report. So when we say 2,423, we should treat that as the floor.
The fatality rate is holding near 40%. And this is Bundibugyo. No authorized vaccine, no specific antiviral. Containment is isolation and contact tracing. Full stop.
Which is why the follow-up gaps in that bulletin worry me more than the headline count. Contact tracing is the whole intervention here, and it's the thing they're saying is breaking. ChannelOne News writes,
The Africa CDC Director General also raised concerns over major gaps in contact tracing, describing it as a critical indicator for determining whether the outbreak is under control. He explained that for every confirmed Ebola case, health authorities require about 40 contacts to be identified and monitored.
So this is Kaseya himself, the head of Africa CDC at the AU summit in Accra, saying it plainly. Insecurity and contact tracing that isn't working. That's the response leadership confirming what the case curve's been screaming all week.
And listen to the phrase he used. He said they can't even do modeling because there's no precedent for this. When an epidemiologist tells you the models don't apply, he's saying the situation has outrun the tools.
He gave a number I keep coming back to. 1,150,000 people in IDP camps. You can't trace contacts through a moving displacement crisis. In this outbreak, the war zone is what keeps breaking the response.
Right, and it connects directly to what he said about health workers. You can't ask people to go door-to-door doing case finding when going door-to-door gets them shot. The public health plan and the security picture are tangled together. Here's science.
Those grim statistics also mean the outbreak is a chance for scientists to learn more about Bundibugyo, the rare Ebola species responsible, and test vaccines and drugs to fight it. On 15 July, the first ever trial of an Ebola drug to protect people who aren't sick but have been exposed to the virus was launched.
So the science headline is genuinely good. The first ever trial of a drug to protect people who've been exposed but aren't sick yet, launched July 15. That tool didn't exist for Ebola before. Bugyo calls the pace remarkable.
It is remarkable, and I want listeners to keep the caveat in the same breath. This is Bundibugyo. There's no authorized vaccine for this species. Remarkable pace still means a Phase 1 study that kicked off in Oxford on July 13th.
Right, so let me ask it plainly. If you've got family in the region right now, does trials are running mean anything for them this month? Or are we talking about protection that shows up in years?
Phase 1 is safety and dosing in healthy volunteers. It's not a dose you ship to Butembo this summer. The exposure drug trial is the nearer-term hope, but it's still a trial. We don't know yet that it works.
And here's what nags at the whole thing. Craig Spencer, an Ebola survivor himself, says the chaos giving researchers all these cases is the same chaos that keeps patients from reaching a hospital and lets their contacts disappear. The science needs access, and access is exactly what's missing.
Which ties straight to what Africa CDC said in the piece we just hit. Insecurity, broken contact tracing. A trial arm can't enroll a contact nobody can find. We're at 2,423 cases, 967 deaths, and what is now the third largest outbreak ever recorded. At this point, the numbers speak for themselves. Here's Xinhua.
South Africa has introduced mandatory health screening measures for travelers arriving in the country from the Democratic Republic of the Congo, DRC, and Uganda, following the ongoing Ebola virus disease, EVD, outbreak.
So this is the one that actually touches an itinerary. South Africa now wants a travel health questionnaire from anyone flying in from the DRC or Uganda. You can fill it out up to 24 hours before you go. And after everything we just heard, nearly 2,400 reported cases, Africa CDC saying contact tracing is failing, a questionnaire is where the traveller side of this lands. Honest question, Sarah. What does that screen actually catch?
It catches self-reported exposure and symptoms before boarding, and it gives officials a contact point if someone develops signs later. Think tripwire, Daniel. For Bundibugyo, with an incubation window of days, a form completed 24 hours out has real limits. I'd focus on the framing. Pretoria is screening from the DRC and Uganda, the two names in the government's own alert. So if your family's flying through South Africa in or out of the region, expect paperwork. Don't read it as a closed border.
Which, for the worried parent doing the math, means you can still travel. You'll just fill out a form. It matters. It just won't protect you by itself.
From the Cooperator News.
The African Development Bank Group, AfDB, has approved grants worth $13 million, about $48.1 billion, to strengthen national emergency responses to the Ebola virus disease, EVDB, outbreak and enhance efforts to contain its spread in the Democratic Republic of Congo, DRC, South Sudan, and Uganda.
$13 million from the African Development Bank, and here's the line that jumped out at me. South Sudan gets $1 million of it. A couple days back, I was asking whether South Sudan even belonged in this conversation, whether we were ahead of the facts. Well, the AfDB just answered with a check.
It did. South Sudan and Uganda each draw $1 million from the Multi-Country Emergency Assistance Project. DRC gets 11 as the epicenter. So the money map now includes all three, and that tells you where the risk is being priced.
And it's split. 10 million through WHO, 3 million through Africa CDC. The same Africa CDC that, in the segment we just hit, told us contact tracing is broken and insecurity is driving the whole thing.
That's the tension to sit with. A dose or $1 approved in a boardroom doesn't automatically protect a health worker in Bunia. 10 million channeled through WHO still has to move through Ituri province, the same terrain Africa CDC just described as a security problem before it's a logistics problem.
For a listener with family in the region, the honest question is, does 13 million actually change the arithmetic, or does it sit in a portfolio while the curve keeps climbing?
Realistically, it funds response infrastructure, surveillance, coordination with health ministries. It buys capacity. Whether that capacity reaches the villages depends on the access problem nobody's solved yet.
If you're following Ebola Watch, you may also want Hantavirus Watch. Daily updates on the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. We'll be watching Uganda's 42-day no new cases countdown. That's the next formal threshold before WHO can declare that transmission chain over. Links to every story we mentioned today are in the show notes, so if one caught your attention, you can take a closer look there. That's Ebola Watch for today. This is a Lantern podcast.